Traction is a pulling force in order to treat muscle or skeletal disorders. Its purpose is to treat fractures, dislocations, or muscle spasms in an effort to correct deformities and to be able to regain its normal length and alignment and to promote healing. Skin traction is a force applied over a large area of skin. It may be adhesive or a non-adhesive skin traction. It uses lighter weights weighing 5 to 7 pounds through strap, tape, or boots. Skeletal traction is an invasive procedure in which pins, screws, or wires are surgically installed for long-term use traction. It uses heavier weights weighing 25 to 40 pounds. When a patient is in traction, proper care is important to avoid prolonged immobility that causes bed sores or possible risk of developing circulatory or respiratory problems. Since our patient is suffering from trauma or injury, he or she is at risk of thrombosis formation. Thrombosis formation is a formation of the thrombus or the so-called blood clot within the blood vessels. It prevents blood from flowing normally through the circulatory system. We all know that blood clot is an important process, but can cause major health problems when it happens at the wrong time. Thrombosis may occur when the blood clot forms in the major vein. When the small particles of blood clot travel to the respiratory system, pulmonary embolism is possible. Heparin is an anticoagulant that prevents the formation of blood clots. It is used to treat and prevent blood clots caused by medical conditions or medical procedures. It is administered within 7 days until patient is ambulatory. Heparin can be used as an alternative, but in this case, we need an immediate treatment to see the visible therapeutic effect in our client. Heparin is given 5 units subcutaneous twice daily, usually 8 to 12 hours.
Wash your hands with soap and water and dry them well. Gather all the supplies and perform hand hygiene. Wear clean gloves to minimize the transmission of microorganisms. Check the heparin bottle for expiration dates. Roll the bottle instead of shaking it, and wipe the cover and let it dry. Put the needle into the rubber top of the heparin bottle. Push the plunger so the air goes into the bottle. Keep the needle into and through the rubber top of the heparin bottle. And make sure to get the right dose of heparin into the syringe.
Morning, ma'am. I-administer ko lang po yung gamot nyo, which is yung heparin. Okay lang po, taas ko po yung damit nyo. Okay po.
Pinch the skin and put the needle in at a 45-degree angle. Push the needle all the way into the skin. Let go of the pinched skin. Inject the heparin slowly and steadily until it is all in. Lastly, press the shot for a few seconds.